fundamental structure is something we can agree on, but there are certainly plenty of areas of agreement. And because I don't think that you can answer the question in the positive to say that people will be able to maintain their coverage, people will be able to see the doctors they want in the kind of bill that you're proposing.
Well, let me, since you asked me a question, let me respond. The 8 to 9 million people that you refer to that might have to change their coverage, keep in mind out of the 300 million Americans that we're talking about, would be folks who the CBO, the Congressional Budget Office, estimates would find the deal in the exchange better, would be a better deal. So yes, they would change coverage because they've got more choice and competition. So let's just be clear about that, point number one. Point number two. You know, when we do props like this, you stack it up and you repeat 2,400 pages, etc. You know, the truth of the matter is that healthcare is very complicated. And we can try to pretend that it's not, but it is. Every single item that we've talked about on the Republican side, if we wanted to exhaustively deal with fraud and abuse, would generate a bunch of pages. So I point that out just because, yep, these are the kind of political things we do that prevent us from actually having a conversation. Now, let me respond to your question. We could set up a system where food was probably cheaper than it is right now if we just eliminated meat inspectors. And we eliminated any regulations in terms of how food's distributed and how it's stored. I'll bet in terms of drug prices, we would definitely reduce prescription drug prices if we didn't have a drug administration that makes sure that we test the drugs so that they don't kill us. But we don't do that. We make some decisions to protect consumers in every aspect of our lives. And we have bipartisan support for doing it. Because what we don't want is a situation in which suddenly people think they're getting one thing and they're getting something else. They're harmed by a product. What Secretary Sebelius just referred to, which is not a Washington thing. In fact, state insurance standards in many states are higher than anything that's done in Washington, is as a consequence of seeing consistent abuses by the insurance companies and people finding themselves helpless to deal with them. Now, we can have a philosophical disagreement about how much insurance regulation is appropriate. What you've indicated to me, just based on the bills that I've seen, is you guys believe in some regulations. You already said you did. You believe in making sure that you can't just drop somebody with coverage. Now, if you don't have a law there, let me tell you, that happens all the time. I've got a bunch of stories in here of folks who thought they had insurance, got sick, the insurance company goes back and figures out a way to drop them. I'm not making this up. I'm not trying to just add to the pages of that bill. It's in response to an actual problem, and you guys have agreed to it. So, philosophically at least, on a whole range of issues, you agree that we should have some insurance regulation. My suggestion had been that we try to focus on what are the specific regulations, since we agree that there have to be some. What are the specific ones that you object to? Now, let me just close by saying this. Pre-existing conditions is one that theoretically we all say we agree on. Theoretically, everybody thinks it's a bad deal if my wife's had breast cancer, I lose my job, I now try to buy insurance, and they say, well, you know what, we can't cover you because your wife has a history of cancer. We all think that's a bad deal. There are two ways of dealing with that. One is what Kathleen raised, which is a high-risk pool. You could say, you know what, you can go in there and buy it in a big high-risk pool. And by the way, you could probably set up a high-risk pool without having as many pages in the bill. And it's an option that's been around for 30 years. Here's the problem. What happens is The reason that all our rates as members of Congress or as elected officials are pretty low is we've got such a big pool. There are millions of federal workers. And as a consequence, any single one of us have cancer, any single one of us have a child with a disability, our costs are spread out over millions of people, and so all of us are able to keep our rates relatively low. Even though if any individual in that situation was trying to buy insurance, it would skyrocket. That's the concept of pooling, is you get the healthy people and the young people alongside the not so healthy and the older people. But we're all kind of spreading our risk, because each of us don't know at any given time what might happen. Maybe our kid's the one who gets diagnosed, heaven forbid, for something. And as a consequence, we insure ourselves by making sure that we're also insuring somebody else. When you get into something like a high-risk pool, what happens is all the sicker, older people are in that pool. All the younger people, they end up getting really cheap rates, and overall you could say, well, that's how the market works. It's a good thing. There's more choice. There's more choice for the young, healthy person, but not for the person who, heaven forbid, got sick. Now, on pre-existing conditions, we've got a similar situation. The challenge we have, I'd love to just pass a law that said, insurance companies, you can't exclude people based on pre-existing conditions. The problem is, what they'll say to you is, well, you know what prevents somebody from not buying insurance until they get sick, and then going in and just buying it and gaming the system? So we've tried to respond to a difficult problem by saying, well, let's make sure everybody has some coverage. Without that, it's hard to do. So I just wanted to respond to, yes, we've got a philosophical objection, but let's not pretend that any form of regulation of the insurance market is somehow some onerous burden that's going to result in terrible things happening to consumers. That's a good thing.
Mr. President, if I could respond.
Please.
We again have a very difficult bridge to gap here because